Dr. Soniya Mathew, working in Universal Hospitals, Abu Dhabi. I am here to tell you some basic facts about influenza. Influenza we know as is commonly known as a flu. It is a viral infection that is caused by influenza viruses. There are different types of influenza viruses, and each year there are different types infecting us. So the common symptoms of influenza infection is sudden onset of high fever, body pain, headache, throat pain, running nose, blocked nose, and for children they will have vomiting, abdominal pain, and sometimes diarrhea. And usually the influenza infection is self-limiting viral infection for persons with normal immunity, but there are persons who have high risk. They are children less than 5 years and persons more than 65 years and pregnant ladies and persons who are taking medications for chronic illnesses like kidney diseases, heart disease, bronchial asthma, and persons who are taking medicines for HIV infections, and persons undergone organ transplantation. These are the persons who are at high risk for influenza viruses and influenza infection, which can lead to complications and even death. So as I told you, like influenza virus infection is a self-limiting disease. So the more common modes of treatment are symptomatic treatment like paracetamol and brufen and cough syrup, something like that. And for the persons who are at high risk, they need antiviral tablets, preferably within 48 hours of infection. Influenza virus mainly affects our nose, throat, lungs, and that is the respiratory system. So the modes of transmission are respiratory route, airborne transmission. Usually main modes of transmissions are a person with influenza directly sneezes or coughs into the face of another person, and that the person gets infection. The other is inhaling the droplets containing influenza viruses, and the next one is direct from hand to mouth, hand to nose, and hand to throat by contaminating the hands. And so the modes of prevention are, main thing is the patient suffering from influenza should not go into the crowded places. They have to take medicines with the prescribed medications at home, adequate rest, adequate fluid, and take regular light food. I would like to say something regarding the prevention of getting influenza infection. The first thing is regarding the patients. The patients affected with influenza virus infection should not go into the crowded places, and they have to take the proper prescribed medications at home, take rest at home, have plenty of water and enough regular light food at home. And the second thing is to get infections is to keep personal hygiene, and we have to practice self-hygiene, and whenever we go out and come back, we should wash our hands and face with water and soap. The soap disinfects the virus. And the third thing is getting immunization. Immunization is yearly once. In influenza viruses undergo mutations every year, so we have to get vaccinations every year. It is almost 100% effective. It is usually recommended, highly recommended for persons who are at high risk for influenza infections. So these are some common facts regarding influenza infection. And the influenza infection is the common viral infection that we get more than once in a year according to the changing seasons. And observing these preventive measures, try to be away from influenza virus infection, and as soon as you get symptoms of influenza infection, don't hesitate to seek doctor's advice and be away from complications. Thank you for your time, and thank you for watching me.